Hi, everyone. Welcome to the live Q&A with Dr. Rob. Before we get started on your questions, he being Dr. Rob, had a great presentation with the We Tonglen group. So if you're a betrayed partner and you do not know about We Tonglen, I'm going to put it in the chat, but it's a membership to the club that no one wanted to be part of, but its members are all female betrayed partners, and there's a bunch of resilient, amazing people there, and they share resources. But they had Dr. Rob do a presentation. So do you want to talk briefly about that before we get to the Q&A?
Well, I just want to say something about We Tonglen, which is I have so much respect for an organization that's not really, they're not tied to a treatment center. They just decided to go out and support betrayed women. And Tammy knows this. I tried in the beginning. I was like, oh, We Tonglen, I'm going to sign up. And I couldn't because I had to check the box mail. And they said, we're really sorry. So it's really meaningful to me that there's an entire space. I'm sorry, it's not what you wanted me to say, but I
No,
really
it's all
like the
good.
site, and I really like that it is devoted to that population because y'all need it. And it's nice to
Yeah,
have some free groups on our site, but nonetheless, I'm glad you have a whole community because that's what it's all about. Okay, take a breath.
but
What
I
they
think
wanted,
they recorded. Yeah, please. Yeah.
yeah. So you can, if you can figure that out, or We Tonglen. I think they go on YouTube. I don't know where you put the link in. So
I don't have the link for the recording yet, but your whole topic was about, what
right,
does treatment look like? So if you'd share just a
right.
tiny bit about that.
So what I talked about was, first of all, I don't think people understand, the consumer understands when should they just go to a support group, or when should the addict go to an intensive, or when do they really need residential? This whole, what we call a continuum of care. And I'll just say that quickly, if you cut your finger and you put a Band-Aid on it, it's fine. Well, you're done. If it's got an infection, you put some antibiotic on it and the Band-Aid back on. Great. If that's not good, you may need to go to the doctor. So in medical care, there's a whole continuum from the least invasive stage to the most invasive. And it's the same thing in mental health. Some people just need to read some books. Some people need to go to a support group, all the way to residential. So I went along each one of those and explained what spouses need and the kind of therapy they're looking for. I also talked about the kinds of therapy. Tell me, like, what is
Thank you.
different between an addict's therapy and a partner's therapy? And I talked a little bit about relationship healing, in terms of the steps toward that, because I think that's something that people kind of don't get right sometimes. Sometimes I'd love to show that here, just those little 5 steps.
That would
Maybe we
be a
could do that
great
later.
idea. Well, I've got an idea. I'm going to write it down so I don't forget. But we have questions, so I'm going to get to that. I did put the
Okay,
link for We Tonglen in the chat. So those of you, oh, there it
guys, you're
is. I
not
was like,
allowed.
where'd my okay, so I'm going to put the first
Lunch.
one in answered so you can find it. Okay, the first question. I think my husband is in denial. He attends SLAA and is seeing a therapist. We signed a therapeutic separation agreement 6 months ago stating no porn use. He tells me he has periodically masturbated to porn in the last 6 months and has used it because he needs to finish off sometimes. He is adamant he is not a porn addict. What are your thoughts on that? Also, can you comment on masturbation without porn in recovery and your advice on whether it is advisable or not?
So Tammy, if you don't mind, could I ask you to break that down into a bunch of different questions?
Mm-hmm.
And so, and they kind of need to be mushed together. Can you
Yes.
help?
Yes. So the agreement with the therapeutic separation was stating, that was
Right,
the
got that.
partner's boundary, no porn use. He tells me he has periodically masturbated to porn in the last 6 months and has used it
Right.
because he needs to finish off. So let's talk about that first
Well,
before we get to the he is adamant he's not a
right.
porn addict.
So I don't know whether he's a porn addict or not, but I don't believe him. I think that we addicts, or most of the addicts are involved, let's say the least amount we can in order to get away with what we're trying to get away with. We don't tell anymore, we don't tell you any less. And that's how you get those small D disclosures, is we only tell you a little bit and then we tell you a little bit more. So I think this person is doing everything they can to only tell you as much as they think you might know or get or become aware of. I'm sort of impressed that he told you that this was going on, but on the other hand, it's, if he told you 1, it's 12. If he told you 12, it's 100. And you don't need to porn. He's not finishing off with porn. He start beginning and end with porn, because I don't say, well, I only ate. Anyway, I don't think it's necessary. I think he's doing it. The other thing is the comment on masturbation, which I want to say something about at the end after you say some stuff, Tammy. But what I don't understand is he's attends SLAA. If he's not an addict, then what is he doing in SLAA, and why does he go there, and why is it have a therapist who's supporting that? So either he has, I don't know about most people, but I don't really want to go to 12-step meetings unless I have to, and I have to my whole life. That's what it is. So why in the world would he be doing that if he doesn't believe he has a problem?
Oh, here's what I made out of this, and I don't know, but I was like, okay, I had a problem with sex, but this is the lesser, this is harm reduction.
Right.
I'm not seeing those I get this all the time. I'm not seeing a sex worker now. I'm just using porn and masturbating. So that is not as bad, even though it's still
Hmm.
all part of the addictive pattern and it's keeping that dopamine going. And yeah, and I'm with Dr. Rob. He doesn't need to finish off. And we've talked about nocturnal emissions before. And if he really has an issue, then it's going to happen without his help. So, but you say he has a therapist, but you didn't indicate that he's got a qualified therapist for these issues. And, what I hear is, I mean, lots of people go to meetings and don't do any of the work. They're just taking up space and listening in and whatever, but giving themselves a gold star. I went to the meeting, I went to see my therapist. I'm also curious of, if this is the plan for, I hear the no masturbating or no porn for 6 months or with the therapeutic separation, but what was the plan for what do you need to see from him so that so that you see that he's making progress, because it doesn't feel like he is, when he's still hanging on to those things. But what was the plan for him to show you that he's changing so that there's a possibility of either coming together or, you go, that's it, we're over? Because a therapeutic separation where there's no plan just ends up being a long time apart with no plan. So that was, a comment for me. And, Dr. Abbas, he's eating, so I'm going to fill in a
No,
bit.
but I want to answer the last question.
Please. Yeah.
Other than that,
Okay.
I'm good. You think I can't eat and
Okay.
talk? I mean,
Okay.
I spit out food. I'm like I have a
Okay.
bib.
Well, that was where I was going next. Can you comment on masturbation without porn
Yeah,
in recovery, which I don't believe this person is in recovery. He has recovery.
right.
So let me back up before you get to, because, abstinence is, I'm just not doing it. I feel like sobriety is like I'm starting to get a clue, but recovery is I'm working a program. You're going to see me showing up differently in all aspects of my life, and that usually takes 12 to 24 months. And there's no hard and fast rule, but yeah, somebody who is still actively engaged in acting out behaviors is not in recovery. He may think he is, but he's doing some things like going to some meetings and seeing a therapist. But I don't hear that he may have stopped, some other problematic sexual behavior, but he's still hanging on to it's like, I'm not drinking whiskey anymore. I'm just, drinking beer. Guess what? It's still a problem. So, okay.
No, Tammy, that was really helpful to fill in because it leads into my next act, which is a couple of things about masturbation. Okay, first of all, for single people, it's different than people in relationships. If I've been single for 5 years and I'm not dating anyone and I'm have no opportunity to be sexual for quite a long time, I would want to talk to my sponsor and my therapist about what about masturbation and can I do it without porn? And I also, as a recovering person, I don't make those decisions by myself. I talk to my sponsor and I say, I've been single for 6 months. And what do you think about this with the porn, without the porn? I talk to a therapist. And then what I used to do, and because I've been in this situation, is I called my sponsor and I said, I'm thinking about masturbating in the next 24 hours. And do you think that's worth a try? And he would say, why don't we see how it goes? And well, not that part, but do it and then call me tomorrow and tell me, how do you feel? And do you feel like acting out? And what has it brought up for you? So simply having sex doesn't necessarily make us want to go act out. So I think that particular thing for single people is different than in marriage. Tammy, one of the things I never hear people talk about is if I want to masturbate and my spouse doesn't want to have sex, they can hold me. They can be with me in the room. I think that one of the things, my caveats to long-term masturbation issue is you can masturbate all you want with your partner there. And if they don't want to be sexual, they can hold you, they can stroke your chest, I don't have to go off to the bathroom with my phone and go masturbate by myself. If that's something I really want to engage in, why can't I go to my partner and say, I'd really like to be sexual. It's not a good thing for me to go do this alone, and by the way, that's an incredibly intimate act. Um, to be with someone and to be holding them while they are pleasuring themselves or being in the other way. So, there's lots of things across the board here. One is I got to be in touch with my program, and I have to help other people help me make decisions in this area because I'm not good at it. So everything's open. If I were single, my plan would be different than if I'm in a relationship. And if I'm in a relationship, I don't understand why that can be a mutually shared thing. And if you don't want to be with me in that way tonight, then I could just not do it. So, but I like to open the door to think about, just because one or the other of us feels like being sexual doesn't mean someone has to go along with it, but it's really nice to be together. So that's a little of the sex therapist part coming out of me, Tammy.
That
Um,
was very helpful. But going back to, I mean, when he fessed up to certain things, I was like, oh, there's more there. So yeah,
no, yeah.
yeah. Okay, here's the next one. Been 14 months since D-Day, 8 months since sex addiction diagnosis, NSLAA and therapy, no acting out. Left home for a year to give her a safe space, now back in home. She doesn't know what she wants to do regarding the marriage, gets mad at me if I'm in a good mood or laughing with dogs and trying to make her laugh, etc. Says I'm either acting that I'm happy or I'm truly not upset with what has happened and is happening with us. I'm trying to enjoy moments, almost 60 years old, and learning to be still in the moment. She says things like she's done or you need someone else, but then seems to change her mind. I get that. She is in trauma therapy. I try to be supportive, but when she comes back at me for being a little bit happy and she's done, it just gets heavier and heavier. I feel by now she should try to see at least some of the positives in my action or recovery, but she doesn't. Only remarks on the negative things.
Well, just a couple of things about this. I think this person, Tammy, help correct me if I'm wrong, has recently or fairly recently returned home after a separation. Is that kind of what I'm seeing?
Yeah, because it said it was separated for a year.
Right. Now
So
I'm
I would
home.
say, yeah, a couple of months maybe home. So
So being separated isn't the same thing as working on something. You may go to therapy, you may go on dates, but living together and seeing that person every single day is a whole new thing unto itself all over again. And so it's great to be out in the world, hopefully dating and getting to know each other again and working on things and even being intimate or, therapy, whatever. But when that person moves back in the house, it's a whole different thing. You have to face them every day. And what partners often go through is this thing that we call ambivalent love. And it's very hard on the spouses because it makes them crazy. They don't understand their own thinking. Of course, I say to spouses, crazy is your new normal, unfortunately. But ambivalent love, and the guys don't get this either. In fact, I just talked to them about this today. One moment, if you're a spouse, you look at your husband, wife, whatever, and you think, oh, look at them in the garden, and wow, they're really taking care of it. Wow, it's really nice, and I love them so much because it's true. And then 3 hours later, they're watching some movie and you saw someone walk by in a bathing suit and you think, they're at it again. I can't believe they're doing this. I just hate them. And this can happen in an hour. So we go back and forth between loving them and feeling what we always felt and going to the hurt and saying, yeah, but I'm all the way over here. I shouldn't feel that way. And we go back and forth. So the issue for us addicts is that we are in this and we may be the same all day. But you're looking at us and saying, well, I hate you now and I love you now. And we're sitting here thinking, well, what did I do to get them to love me? What did I do to get them to hate me? And can I do that again? So this is trauma. This is how trauma plays out, is this kind of going forward and going back and sort of testing the waters and jumping back out. And I think this is where you need to be patient with your spouse and understand that having been separated is not the same as facing each other every day. Of course she's angry at you. Of course she's hurt. Now you're around the things all that remind her of the past and the things you've been through. So, and yeah, I've had many a spouse say, what do you mean you're in a good mood after what you did to me? And, I'm glad that the recovering addict is in a good place, but I completely stand a spouse saying, you don't even get the right to be in a good mood after what you've done to me and the pain. How can you be smiling with that? And then means you don't understand the pain I'm in. So, these are two people in two very different places in their emotional life, trying to figure out how to go forward. And they're each having dissimilar feelings at the same time. I mean, it's just a very difficult process. And by the way, your last sentence, I wrote a book about this. It's called Out of the Doghouse, a relationship saving guide for men caught cheating. And what that is, or what I say in there is It is not our job to get gold stars from our partners. For us to be working on ourselves actively and doing what we need to do to be gentle, kind, and sober, that's our job. So if you want me to cheer for you because you've got 3 months together, I'm going to say, wow, I'm really proud of you. You did great. You want to go to your therapy group and show your 90-day chip and have them say, oh, you got 90 days? That's fantastic. But you go home with that chip and you say, I have 90 days. And your spouse says, well, good for you. You have 90 days or you haven't been cheating on me, but we've been together 10 years. It is not a spouse's job to give us gold stars and cheer for us when we're just doing the bare minimum to recover from this abuse and abuse of trust. So I suggest you, and I say this to the guys all the time, you absolutely deserve validation, support, cheers for what you're doing right, and support for when you're not doing it right. But that is not your partner's job. Their job is to take care of themselves and to sit back and say, let me see how this is going. And you know what? If they're hurt and angry, they're hurt. This is someone who should take the out of the doghouse course. Don't
I
you think,
just put I put the link in. There was one started at 5 o'clock tonight. So, but we have
Can
people
you
that
help
miss one session
explain
and join.
why,
So
or
yeah. So a
can you help
work group
explain
is
why that would be?
an online work group. Is different than reading the book because it's live facilitated. All of our work groups are 6 weeks in length. They're 90 minutes long, live facilitated. So you're not just watching a video, and it's connecting with other people and something that you wouldn't have thought of. Somebody else will ask about, and you, oh yeah, me too. It just really helps affirm and cement the information. But we have Out of the Doghouse based on your book. There's a workbook too, and there's parts 1 and 2. So ultimately, that's a 12-week course if you do both parts of it. So really helpful, and for people like you that you've got some solid recovery behind you, but you're going, how do I navigate this? How do I show up differently for my partner? Gaining some empathy. Yeah, one of the things I was thinking of is hold your emotional fortitude, and it's tough to do because you want to go, why can't you see what I'm
Right.
doing? I get it, and we get it, but I am so sorry that my past behavior has hurt you so deeply. I am working today to do things differently so that I can be a different person. Just affirming, the hurt,
Empathy.
and that you're doing the best that you can today. No promises. I'll never do that again. Don't even go there. But just, take a deep breath and say something along those lines. Affirm the pain, and that I'm doing the best I can today to make sure that I don't return to that hurtful behavior. That's what you got. And what her reaction is not up to you, but you
Right.
don't deserve any abuse. And I just hear negative, talk, but,
Right.
abusive language, abusive actions, healthy boundaries for you on that as well. And it may be, I see you're upset. I'm going to take a little break and we'll come back. I'd be happy to talk to you, whatever it is, but this too shall pass if you're both committed to the process. And she's still with you. She let you back in the house. To me, that's a good sign, because she didn't have to.
Right.
I've had people, we've been separated 3 years, so go ahead.
And I want to add one thing, Tammy, which is there's anger in here. There's resentment in this letter toward her, which disturbs me. And I think if you're a
Mm.
spouse, you get this. I feel by now she should try and at least see some of the positives in not her job. Not her job is to find peace, to deal with her anger toward you, to get support from other women and for herself and her life and enjoy the things that make her happy. Her job is not that. And so this feels like mommy. Mommy, please cheer. Mommy, I did well in school.
Mhm.
Mommy, she's not your mother. It's not her job to cheer for you. When I don't punch someone in the mouth and say 6 weeks later, gee, I noticed you're not saying how well I did. So I understand, as Tammy said, I have the compassion, but I think what you're asking is unreasonable. And if you want to get your spouse where you want them to be, you're going to have to back off all of this pressure that you're putting on the relationship to be how you want it to be.
And what space can you give her so that she can go have joy with her girlfriends, or what's gonna help her, and not feel in the conflict, but I don't know, but you guys having each, some separate time to connect, mindfulness or whatever it is that, that helps. What's outer circle behavior for each of you would be, something to consider too. Ready for the next one?
Yes,
As
ma'am.
a recent betrayed partner whose husband is not acting out with intercourse and only semi-regularly, is abstinence for sex necessary for everyone? I hear lots of contradictory advice and timelines. We have always had a very good and natural sex life.
So
So
I get,
go ahead. I
go
was going
ahead.
to clarify, but
Well, I get part of it,
mhm.
and I'm not sure about the other part.
So this
So
is like people that say, oh, it was just porn addiction, so why can't we have sex, or what? So the addict wasn't acting out with intercourse with someone else, so whatever the sexual
they
behavior
say,
was something, right? I know this,
they
and it's
say.
recent. So this is,
So
so here's what I
let
hear
me
often. Go ahead.
go
I was
ahead.
going to say, here's what I hear often is, this happens a lot with porn addicts. I feel as a partner that I'm just part of the porn. So it depends, it depends on, where you're at. And, there's no magic, 90 days, without sex, and then you
Right.
magically flip a switch and everything's all better, and brains don't just magically reset. I mean, like this takes a lot of work. So I guess what is the, I would wonder what it is for you and what it is for him. What are your expectations, for having sex? You guys get to, to pick your path. I mean, everybody does. But Dr. Rob says this often. Do you want to have sex with somebody you don't trust? Do you trust that he's all of a sudden, because this is new, that all of a sudden he's truthful? Like we just commented on somebody who says he said that, whatever. We both went, yeah, we don't really believe that, so it really is, where is he on this journey, and how is he showing you that he's showing up differently and trustworthy? So thoughts, Dr. Rob?
Well, I just love the things you said, Tammy, because what I want to build on is this idea that you're focused on him. He betrayed you, and this is no harm, no foul. This is what I see. Take what you like. But what I hear is, okay, say I've been recently betrayed, which means harmed, left, not knowing where life is going, completely overwhelmed, and you don't really know what you don't know. And now you're looking and saying, well, should he be doing this or should he be doing that? And then different people are telling me that he should be doing different things. And I'm concerned about you. How are you doing? How are you taking care of yourself? What direction do you have? What plans do you have so that you begin to both get in touch with and revive yourself after this? I think you're at the very beginning of a journey that's going to take a long time, but I'm not sure that the questions, we don't know what he really did or didn't do. The abstinence, as Tammy said, our brain doesn't flick a switch at 90 days and okay, well, I'm not interested in this. Is a chronic mental illness issue, just like depression. It just doesn't flip a switch and it never comes back again. So um, uh, what I would ask you to do is really take some time and think and look at, how has this affected me? How is this affecting my life? How is this affecting our children? Who am I talking to about it? Who do I feel safe to talk to about it? What books have I read? Again, I'll go back to the work groups. We have a betrayed partners group, right, Tammy? So,
Yes.
sit with, and those are educational. Like we have support groups where you sit and you get information, you look at the other folks, you chat in the room, everyone gets a time to talk, moderated by therapists. Those are free. But these are educational. So you're getting information and then you've got homework and then people are talking about the work. And so it's not as personal, but it does really give you an opportunity to, and you don't have to say anything, to sit back and understand the process. And what I think is needed here is I think you could use a lot more education about what it's really about and how it takes place and how we get better. Yeah. And you know what? You may not have a good and natural sex life for a while. And I think that's another thing that partners have to grieve. Maybe you had a very comfortable, intimate life on a whole bunch of levels, and now you don't want to be anywhere near them, and that's a loss for you. So anyway, Tammy, why don't we continue around the road
Yes.
and
I
see
put the
what we got?
betrayed partner. We have another one starting April 27th that it really is good psychoeducation. It's not therapy, it's not treatment, but it's different. It's not 12-step, but Angela Spearman does a great job from a pro-dependent lens. And like with the betrayed partner, that question, I was just thinking, what is it that, you had a very good and natural sex life, and he was lying to you. So
Right.
there's a disconnect. He was
Right.
compartmentalized. You feel like that's where your connection and the intimacy is. And I say all the time, sex is
Mm,
not necessarily intimate, because sex addicts prove that
right.
all the time. They'll have, well, it doesn't matter, but so that compartmentalization. So I would really invite you, like Dr. Rob said, explore yourself and your feelings about everything. I kind of feel like it's like, this is the one place where we can connect, and I don't want to lose that, and I honor that. I'm not trying to take that away from you. I would invite you to explore that. Okay. Addict. I have just upset my wife again by not packing a lunch like is on my daily checklist, and said purchase pre-made food from the store. Advice on keeping everything consistent so I don't trigger my wife. Hard to predict what will cause her pain. This is another out of the doghouse, because I'm like,
Another
if you
doghouse
say,
person.
here's the deal. Dr. Rob has one of the examples. If you say you're going to take out the trash, take out the trash. Like part of addiction, or part of recovery, not addiction, well, is doing what we say. I love that our program is called Seeking Integrity. We need to show up and do what we say we're going to do. If we're not going to do something, we need to notify whoever it is that is expecting us to do whatever. And I'm kind of wondering, what was it that made you decide not to pack a lunch, knowing that that was one of the things that you agreed to? I mean, to me, this feels like, I understand your wife being upset, because if you're lying about or not holding a boundary about lunch, how can your partner
Right.
ever trust that you will be truthful and do what you're supposed to about sex and porn and everything else? So, out of the doghouse work group.
Um, yeah,
Go
I
ahead.
was just going to say that, yeah, I mean, this is all about you. This is all about, well, I didn't do it right. So when am I going to do it right so that she will act the way I want her to? If I do it this way, she won't be triggered. If I do it that way, just go get lunch. Just do the laundry. Just do what's in front of you that you need to be doing and you're supposed to be doing, and let go of the rest. Maybe she'll be angry. Maybe she won't. Maybe, unless you've actually done something that is a lie or lacks integrity, or she's caught you in some situation, she's going to be, like I said, she's going to be all over the map. And what I see here is a little bit of narcissism and a lack of empathy. And that's exactly why I wrote out the doghouse, because I got to tell you, not only have I never met a sex addict who understood how to heal cheating with a woman, I've never met any man who really understands the pain of a woman who's been violated through having been betrayed. So I'm giving them a little hint, a little heads up. This is how you do it, because they just don't know how. We're good at saying I'm sorry. We're not so good at trying to even understand what you're going through. And that's unfortunate, but you can work on that. We have workshops. Anyway, Tammy, please, what we got?
Yes. Well, I have one more thing. If it's like, oh, I was running late this morning, pack your lunch the night before. Then it's not even an issue. You just grab it out of the fridge and go. So, okay, next question. You say you don't want addicts to say, I got this, and be confident. You want them to be nervous about staying sober. Why? Shouldn't they be positive about, I got this?
It's a great question. I don't get asked it very much. Um, this is a chronic, ongoing, and we mean one day at a time, sometimes 1 hour at a time disorder. You don't always know when it's going to crop up. You don't really know if what you're doing is going to leave you not wanting to do it. Is really one day, someday I'm stressed, I need more. Some days I'm doing better, I need less support. Um, so I would rather someone weigh in on the side of, gee, I better do everything I can to support myself and do well today, rather than on the side of, oh, I'll be fine. We need to practice on a daily basis some kind of organized way to take care of ourselves. And even then, sometimes we really struggle. If I were you and any spouse here, I would worry about the person who says, I'm never going to do this again. I completely get it. I know how much I hurt you. Well, why would I ever do that again? They don't get it at all. They just want you to calm down and shut up. I think that the honest thing for anyone who understands their own problem is, I have a serious problem and I've struggled with it for years, and I'm probably going to, in my head, struggle with the rest of my life. But my actions don't have to be like that as long as I follow a particular set of healing structure, principles, all of that. So it's not about being nervous, it's about being aware. that I am vulnerable and that I can end up back there rather than I'm fine, nothing could lead me there. And I don't have enough trust in myself as an addict to know what's going to happen tomorrow. So I don't understand who someone who's brand new at the process can absolutely reassure you that this isn't going to happen because it may and it probably will. Tammy?
Yeah. So, and I'm with you. It's not about nervous. It's just I have a healthy respect for my addiction.
Right.
That's really what it is. I have a healthy respect for my addiction. I've been doing this a while. I mean, like literally decades. You know what? I don't say I've got this. I say, like I mentioned earlier, I'm doing what I need to do today to take care of this so that, I don't have to worry about it today. And you know what? Today I didn't act out. Today I've stayed, on a serenity beam. It's one of those things where and for me, it isn't even really about the acting out. I'm pretty confident that I'm going to continue to do what I've been doing, and that will be successful because it's shown it will be. But it's I don't like not having my serenity. I don't like having, the chaos and all of that. So I'm willing to do. It's just a whole lot easier to keep doing what I've been doing successfully. So I don't say, I will never promise my spouse, I got this. You don't ever have to worry about me. I will say I'm doing what I need to do today. So it's not about nervous, but it's just my addiction is here. And you know what? Addicts we lie to ourselves. We lie to ourselves before we lie to everyone else. And so just going, yeah, well, that doesn't really, I know people who have had decades of sobriety, the abstinence or whatever, but they quit doing what they needed to do to take care of it. And guess what? They, if they're lucky, they come back to meetings, and they are starting over again. They're a great reminder to me of why I just need to do what I need to do today. So. Next question. I had discovery 5 weeks ago and learned I was betrayed by an affair through online dating. I learned slowly that he has interactive phone and cyber sex for more than 10 years and started online dating a year and a half ago. He started his first affair this past February. I don't understand if this would classify as porn or sex addiction. He says the label doesn't fit. How should we proceed?
Tammy, do you want to give it a start?
Well, I can, but I'm like, this is kind of like the one before where it's like, well, I'm not a porn addict. It doesn't matter. You've been, he's had at least, this is what you found out. And this is not about you digging for more. There's a whole process, formal therapeutic disclosure, if he actually gets into, on a recovery path, et cetera. So just, this is tops of the waves with all of this, but he's been lying to you for at least 10 years. I don't know how long you've been together. But he's been lying to you. So, him going, I used the analogy earlier. It's like, well, I'm only drinking beer, so I'm not really, I'm not really, it doesn't matter. This is lying, secretive behavior. He's been doing things that were not in agreement with your relationship. I assume you're married, but that's an assumption. But if you had vows that said you are going to stay together and there was not, permission for all of these other things, then it's been against the agreed upon plan for your relationship. So there's on our website, we'll start here. There's a little self-assessment. Label doesn't matter. Intimacy disorder, you can call it whatever you want. Guess what? There's a problem and he's betrayed you. He's lying to himself. He's minimizing with you. Like Dr. Rob said earlier, what you know is part of the thing, but there's a self-assessment and have you or have him email me, Tammy, TAMI at seekingintegrity.com, the score. Pay attention to the score. You got to count and then tell me the score and I'll help you have the resources based on what the score is. That will be helpful. But, arguing about, it's like, like I said, addiction is addiction. Dr. Rob said it too. Addiction is addiction. It's a chronic mental health issue. It's got nothing to do with, with parsing out, oh, that doesn't fit. So anyway, thoughts?
Well, to me, it's like saying, my friend has cancer, and, I might be very concerned whether it's breast cancer or colon cancer or, but the truth is she has cancer. And so whether you call it porn addiction or sex addiction or some combination thereof, it's still the same problem. And the problem is not just the sex, that's the tip of the iceberg. Any partner I've ever talked to says, you know, we haven't had emotional intimacy in a long time. I haven't felt like he or she's been vulnerable with me. I haven't really felt supported. I haven't felt like they were listening to me. I feel like there's been such a distance between us for such a long time, or even worse, I kind of gave up on our connection and realized this is just what it was going to be. I hear that stuff all the time, and I'm sure Tammy does as well. And what that says to me is that it doesn't matter whether it's sex addiction or porn addiction, whatever the presenting problem is, or the tip of the iceberg, I bet underneath there's a whole lot of other things that are missing in your connection. And so whatever we call this thing, what we know, it is a symptom of the disconnection. Now, as far as him not liking the label, gee, I don't care look what he's done to you. Look what he's done. He's worried about being labeled, and you have been with someone who's been having phone sex and cyber sex and online dating and having affairs, and he's worried about the label. I have not so nice words for that. And I'm concerned about you even asking this question, because you don't have anything that you need to question. You have been meaningfully betrayed. And he is trying to engage you in an intellectual argument that keeps you out of your emotions. As long as I can talk about it with you, and let's look at it this way and looks at it that way, I can distract you from what you're feeling. And in fact, I can gaslight you and tell you, no, you don't understand at all. But what I'm trying to do is keep you from getting upset. So, and I want to protect myself. So this is somebody who is trying to keep you out of the soup, and himself, by staying in the, what is this? I'm not sure. No, I don't agree. It's not what and is it this one or is it that one? Neither one of you are really dealing with a deeper issue. And my sad thing for you, I want to say their name, but I won't, is that you have a lot of pain ahead and a lot of loss ahead. And again, this is interesting, Tammy, how there are themes. I feel there are a lot of folks a lot of women in particular in the early stages of healing, and a lot of guys with the doghouse issue, they have no idea how to create healing. So we got a couple of themes going tonight. I feel bad for you because you too are in an intellectual place, which keeps us safe. Thinking about things is a lot easier than feeling the pain of the loss. And I hope, in fact, that you stop in one of those free support groups that we have, and just talk to some of the other women about what they're going through and what they're learning about. And, I feel like, and this is just my gut, that you're kind of alone with this. And I want you to have a lot more support, in dealing with this and working on this, because you got so much to figure out. It's been 5 weeks. So I hope that there are women in this room I know who would love to talk to you and support you about what they're going through. So stop in one of the groups, the support groups.
Yes.
Yeah.
So you're gonna it's gonna be a lot of ditto for the next one. So this is the husband of the first question. When I say I'm not a porn addict, I mean that watching porn has never been a compulsive behavior. Weeks or even months can go by without using porn at all. It's not something I can't live without, or that has overtaken my day and times. And I'm thinking, but you're doing it when the agreement was that you wouldn't do it. And I mean, so I'm going to use another drinking analogy. There's something called binge drinking, and people go, "Oh, well, I'm not drinking every day." It doesn't matter. It's like, you're still doing it. Even if you can go a month without drinking, but when you do that, yeah, and if it really wasn't an issue, then why would you ever do something that is going to cause more harm to your spouse and relationship? The deal was no porn, and you are.
Right.
So if it real, and you're saying weeks or months, and there's at least 3 times that you have in that 6 months, probably more. So to me,
Mhm.
this feels like you're lying to yourself and minimizing, gaslighting your wife. And at the end of the day, if what you really want to do is do porn and masturbate, then then your relationship may not survive that. If having a connection with your wife, who clearly loves you because is showing up at this, still working on the relationship, is the goal, then getting help so that you don't continue these behaviors. But holding on, addicts, we hold on to, I want to hang on to that behavior. I can't imagine not being able to do what it is. It's my maladaptive coping mechanism. But trust me, living in real recovery, the world is way more interesting. And Dr. Rob is using the analogy of like it's going from black and white to technicolor. And that's true, but when we have our head down, focused on hanging on, to behaviors that hurt you, but hurt your wife in particular, that doesn't bring us true peace and joy. So
Yeah, I want to double up on that, Tammy. I don't care what you call yourself. Why can't you keep an agreement to with your wife? I mean, if she feels there's something going on and you say, I'm going to do this, it's disrespectful to just go back and do it. So if it isn't a compulsive problem, why don't you keep your promises? And if you don't keep your promises to your spouse, then that is a big problem. And why are you not keeping your promises around this? And if you're not keeping promises around this, what else are you not keeping? So either way, you're effed. You've opened up a whole kettle of fish. Tammy, I know $5 barely buys a cup of coffee, but I will bet you $5 that this person is sitting with their spouse next to them. And they are sitting there
no,
trying to
they're
say, oh, no,
separated.
you don't
No,
understand.
they're separated. This is that
Or
they
is
were
on
separated
here,
6 months. Yeah, yeah.
this is someone it feels like who's saying, no, 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 I got to prove this.
Hmm.
There's one other thing you said also. Yeah, yeah, I'm just going to move on, but
Okay.
yeah, let's just move on.
My essay faked recovery for 2 years and lied to a CSAT. And I'm sorry, but that happens, right now the record for people coming into treatment was 11 years of lying to their therapist. So, but it lied to a CSAT sponsor and obviously me. He continued porn use and acted out with others sexually. My CSAT hasn't helped me even set clear boundaries with him. And now I'm realizing how behind we are in every aspect of recovery, including not having disclosure. How do we proceed? He's looking at residential in July or seeking integrity. Come sooner. I'm unsure if continuing in the relationship, but yeah, so don't do disclosure. He's still lying. So getting support for you from a pro-dependent lens, if you don't have a qualified professional, Tammy, TAMI at seekingintegrity.com, and I'll help you find
But
somebody who can
Tammy,
help you.
can you explain to them that not everyone takes a certification, even though it's
Correct.
very thorough? The CSAT is, I don't know, 3, 6, 9, 12 days over a year plus 30 hours of work. I mean, it's not an easy
Is
thing to get.
right.
However, can you explain to them that not everyone that goes through all that knows what they're doing? Please.
So I used to work for the organization, and I always said we can give education and tools to a good therapist and help them be so qualified and so helpful in these areas. But then, and this is recorded, and I don't care. There are therapists that they can have an education, but it doesn't make them a good therapist. And so this is unique work. And unfortunately, Dr. Rob talks about this. He has a peer case consultation group for professionals from all over the world once a week. And they come and talk about cases anonymously, but to help support clients. Those are people that are want to continue to hone their skills and learn. So, but not everybody wants
But
to.
even
Not everybody's a
they,
good therapist. Yeah, go ahead.
but even they often we're trained in certain kinds of therapies as therapists, and most of
Yes.
them are very compassionate, very nurturing, very, what's going on with you? Let's talk about it. Do I understand this? And most therapists, that is how they work. But when you're working with issues that involve behaviors like drinking or using or cutting on yourself, or that requires a very structured, very intensive, very organized way of dealing with the treatment. And the problem is that many therapists understand what work is asked of them, but they don't understand how to do it. I'm pretty good at it. I'm very direct. I'm very clear. I don't pull punches. I'm really good at evaluations. I have no problem disbelieving you. Most therapists are like, well, they came to me for help, so they must be telling me the truth. And if your grandmother died and you're grieving that, you probably are. But you are, unless. So I would have Tammy another $5 as I lost the last five. That I would know within 20 minutes if he was being honest with us or not. I'm pretty good, but isn't it interesting? He has a therapist who he was able to lie to for years, and and then he continued to act out, and then you haven't gotten a sense of clear boundaries, and you're behind in disclosure. I mean, maybe this isn't going very well with this particular professional. If nothing else, you can get a consultation. You can have a consultation with me. I meet with people for 2 hours and Tammy can set that up. You can also just have a consultation with a different CSAT and say, you know what, this is where it's going, that's where it's going. Can you help me understand, how I can get the support for going forward? Again, I hope that you're going to some of the partner support groups because you'll hear, and maybe you already are, hearing the pace at which things work. We don't want to keep you in the dark for a year and a half. How are you ever going to move forward as a couple? So, and yes, you have to have, well, let me take a breath, Tammy. Everything here that is missing is everything that we do in treatment. And unfortunately, many therapists are not familiar with a treatment model. They're more familiar with a psychotherapy model. And as a result, see how I'm talking slower? As a result, many of them work slower and more relationship weighted. Here's another example, and no therapist like this. I'm more like a doctor than I am a therapist. I know the answer to how to help you with your problem, and you are coming to me and you want me to give you that answer. That's not what traditional therapy is about. Traditional therapy is about exploration and curiosity, and you are coming to me because your life is a mess and you want me to teach you how to fix it, and that's my job. If you're not getting that from the professional, very concrete direction about how to make this better, then I would be concerned. There's only one other thing though. Have you sat in therapy with your husband? Is it husband? I fake my essay. Have you sat in your SA therapist's office to find out what's going on? Have the four of you, you and your professional and him with his, sat together and you said, I don't feel comfortable with it. There's a lot of professionals in this soup. Are you all coming together? Because that's what one of the things I really like about Seeking Integrity. We work as a team. The guys know that we talk in the morning, we talk in the afternoon, we talk at night. We're constantly talking about them, the clients. We're not gossiping, but we're working together as a team. And you have a team, but I wonder if they're communicating with each other and bringing you together in a way that these issues can be resolved. Something ain't right. Excuse me. And you're right to bring it up, I think. Tammy, you put something in chat. I was wondering what you threw in there. I wonder. Oh, you threw something in.
It's don't worry about it.
Oh, it's personal to that person.
Yeah.
Okay.
Yeah. So, okay. So betrayed partner, 2 months post disclosure, working recovery for almost 2 years, including no physical intimacy, and trying to stay open with my spouse to see if we can repair and reestablish an emotional connection. I've been having physical urges to be with him, but I worry this will send the wrong message and also take me off track from my healing work and his recovery work. We have in the past trauma bonded physically, and it's important to me that this time we have a strong emotional connection.
I'm writing notes here. Um,
I wish you were in the
things.
couples healing from betrayal work group that started last week, Thursday. That would have, that's kind of some of the
And
work
why
that they
is that,
do.
Tammy?
Because that work, and I could still add you, don't worry, but it's a small group. But Dr. Susie LeBrock, it's grieving losses together, communication, what is healthy, intimate, what is healthy sex, for you. That's what that group, it's a really good, we always get really good feedback when we only offer it a couple times a year. So, and it's a small group. So, but anyway, so what were you going to say? I'm sorry.
Well, I just, first of all, I wrote down what is sex, because sex can be a massage, sex can be mutual masturbation, sex can be all kinds of things, and and intimacy doesn't have to be sexual. You can stroke each other's hair, you can take a shower together, you can do all kinds of things that are physically intimate without it being sex. I also want to add that I really want you partners to understand that you will never responsible for our acting out. Never, ever, ever. If we have sex and I get triggered by that and I go do something, well, guess what? I could have called my therapist. I could have called my sponsor. It is not because of you or our sex that made me go out again and end up in this place. It is a decision that I made or something that came up with me that I didn't address or that I didn't have a community to turn to. So please, spouses, whether you're encouraged to be sexual with us or not, whether you're in a place to or not, understand that it is our struggle with our sexuality. It isn't yours. Now, if we tell you I'm supposed to be absent for the next 3 months and then I want to have sex with you, that would give me a bit different message, which is why am I being lied to? I wanted to say something about your physical urges to be with him. I think it's and Tammy has seen this a lot. Once partners get disclosure, And once you see that your husband or wife or whatever it is going on the right track, there's a part of many spouses that feels like, oh my God, for the first time, I feel more connected to them. And now I know everything that's happened. And now I understand us better. And all of a sudden, and they're being honest and they're being more open. So you're beginning to have the person you always wanted, and there's no more secrets. And guess what? You want to have sex with them. That's understandable. I've seen many partners go to this place of reconnection inside of themselves, even though it hadn't come all the way up to here. So I think it's good to question yourself, but I think it's absolutely understandable that the more you learn, the less you're in secrecy, the more you see your partner do what they need to do and be respectful of you, the more attracted you're going to be. And I just really think that you should be kind to yourself. So about the rest of it, all I can say is one thing. Are you talking to each other about this? You say, I worry this will send the wrong message and take me off track. Have you said to your husband or why, whatever it is, have you said, I'm worried that I'm attracted to you and this might happen? Have you said to him or her, I don't want to send you the wrong message? And have you said to your therapist, I'm worried that this might take me off that track that I'm working on? In other words, are you really talking about this with each other? I think it's extremely important that you go to your spouse and tell him or her, I'm worried about this and I'm feeling attracted to you. Uh, how do you feel about that? Are you worried about that? Can you reassure me by telling me that you're reaching out to your sponsor every day, so you won't be alone with this? What is all of that about? And by the way, there's one more thing. I'll never stop talking. What's the worst thing that could happen? So you get triggered around trauma. Okay, you've had that happen before. So he has a slip in his recovery. Life has not ended. No one's jumped off of a building. You're in a process of repair and and trying to find the right way to go, the most healthy way to go forward. Not everyone's going to do it perfectly. But I'll tell you what, you'll always do well if you are openly communicating with each other. And then when you run into those cracks in the sidewalk, you go and talk about it with your professionals. But this all, and by the way, Tammy, you gotta hand it off to a partner who's really concerned about doing it right. Here I am feeling closer to this person, but I'm worried it will be a problem. Here I am really doing well with my trauma, but I'm afraid, there might actually be some good things happening here. I mean, it sounds that way. And you can learn more and explore it and see where it's really at.
I put sensate focus touch in the chat
Mhm.
because this is going to feel awkward and scary. I mean, just think about, well, a long time ago when you first started, like go back to dating. How can you hold hands? Can you massage feet? Is there some touch that you will, that can help you draw near to each other? But the communication, I was thinking the same thing, Dr. Rob. It's like communicating. I'm scared. I'm nervous.
Right.
Addicts have a terrible time, like often, because it's like, oh my gosh, I'm so used to doing it, under the bubble of, sex addiction. And now I have to do
Right.
this and show up differently. And, so,
Right.
what can you do to just take the expectations down, to take the tension down, start slowly, do the touch that feels good. And, like, but 2 years, I mean, so at some point, it's like if the goal is to be connected in a healthy way and including sexually,
Right.
then, Doctors Bill and Ginger Burkaw did a podcast with Dr. Rob on sex, love, and addiction about sexual reintegration. And they wrote their book before there was codependence. So it still has some codependent language. It still is helpful. Take what you need and leave the rest. But there's so many different tips and tricks and tools to use to help start navigating that. But a lot of it is you're building communication and honesty. That's a place to be really honest, and share vulnerability. I'm scared, and I bet he says I am too. Good. That's real communication.
I want to quickly go back to,
Hmm.
you said, I have been having physical urges to be with him. What is that?
Hmm.
Does that mean that you want to massage your shoulders? Does that mean you
Hmm.
want hugs? Does that mean you can be physically with him and not necessarily be having penetrative sex? And and that's where you should start. Going right to the end point is traumatizing for someone who hasn't done that for a while. And can you hold hands? Can you spoon? Can you take steps? And by the way, if one of those doesn't feel right, you can stop right there and
Hmm.
say, in the moment, I feel uncomfortable right now. Can we stop? This is how you're going to find your way through. Trauma is about not being able to have a voice. And you get to have a voice here and say, bring yourself closer, put yourself further away. You have to have the safety of that. So don't start at the end point. See how it goes all the way through. And Tammy's right, sensate focus is a great exercise to go toward that. Okay.
So the next one, I find myself disgusted by his actions. I met my husband when he was 16 and we are now 28.
Mm.
I am very upset by all the lies, but I'm upset that he has been with so many people, and that's what disgusts me. I've only been with him. Will my feelings ever change?
Well, I'm just going to say one part, and I know, Tammy, if you don't mind speaking to the last part, you started when you were 16. And, I actually, Tammy, have partners who started at 19, who got together at 21,
Mhm.
and you didn't have any relationship experience. You'd never lived with someone, you never really dated someone, you were 16 years old. And so what I find partners who start early is you don't know what you're doing, and it might be good at the beginning, and then something is not good, and you adapt to that, and you adapt to this, and you adapt because you don't know any better. And so, I'm just saying that I understand why you wouldn't have seen this, because someone else who started at 30 and had been in a whole bunch of other relationships, they might have seen what was coming. You're so naive and so young, and yeah, what I hear in this is you devoted your life to this person and that you absolutely believe that they were devoted to you. And will your feelings of love be there in the future if you want to pursue the relationship? Will there be the beginnings of trust or reconnection at some point? I hope so, if he's working really hard on it and you're beginning to do your support as well. But will you ever be able to look at him the same way again? No. Will you ever, and I say this a lot, will you ever fully believe when he walks out that door that he's not going to hurt you? I think this is the challenge for every spouse is you used to leave and I thought, well, whatever they're doing in the world, they've got my back and they would never do anything to deliberately hurt me, except maybe spend a little too much money. And and then you find out that we didn't have your back and we actually can go out in the world and deliberately do things that we know you will hurt you, that we know will hurt you. And once you've experienced that, so no, yes and no. Yes, you can recover all kinds of new feelings, new experiences, new connection, and love and hope if the work's being done right. But you will never look at the relationship again, and your feelings will be altered for him forever. That is true. You can't unknow something. Tammy?
Well, yeah, and the disgust, and it feels like, and I don't know this, but it feels like you're taking on the shame of how did I let this happen?
Yeah.
And when we use naive, we don't mean it in a derogatory tone at all.
No.
I say to couples all the time, or to trade
Innocent.
partners, yeah, yes. I say you will never naively trust him again because, like you did, because he has shown that he can hurt you, and so perceiving that would be harmful to you. So you always need to hold that that particular place. Understanding so Dr. Rob talked about this is a mental health condition. It doesn't give him a pass. It's not an excuse, it's a reason. But like Dr. Rob said, if he's willing to do the work, he can change. He can be a person of integrity. I mentioned it earlier. I love that our recovery program is called Seeking Integrity. We strive for that personally. We help other people have that as well. We don't do it perfectly, but one day at a time, we learn to do life differently. So I don't know how long this has been since you had discovery, but him getting the highest level of help when you say so many people, I mean, we hear lots of
We
big
know.
numbers, yeah, we know lots of, but yeah, the hurt that it wasn't just the two of you, I get it. But there is qualified help, there is hope, that he can change, he can learn to do things differently. He can learn to show up as a real partner for you if he wants to. The other thing is you guys are young. What else he can do? You guys can divorce and he can do this for, 5 more relationships, and come to us in a lot later time frame, having made a mess of a whole bunch of relationships. So I hope he gets the help because that changes everything for him, and for your family if if you have children, et cetera, too. So
And I wanted to jump in on the disgusted part.
mhm,
I
mhm.
would feel like my body had been soiled. I would feel like I had this ick on me that I never asked for, and I can't get off me, and it's on me. No, that's I would feel like I didn't invite all of these bodies into my life,
Mm-hmm.
and now
Mm-hmm.
they're all over me and I can't get rid of them. So I completely understand your disgust for a whole bunch of other reasons. And the one thing that came up for me, and I want to be very clear, is please go and get an STD test. Every spouse, please go get, I don't care what we say we do, please. HPV, syphilis, gonorrhea, herpes, get all of it and make sure that you are safe, for a whole bunch of reasons. Because there are many things that men can get that we don't have symptoms, but they are very destructive to women, like HPV, for example. So take care of yourselves. It's probably one of the most humiliating things you're going to go through. And there are free clinics if you don't want to see your own doctor, but please make sure physically you're taking care of yourself. That's important to me.
I agree. And there's
Okay.
so many good questions. I really wish we could have gotten to them because but we can't, we're past time already
But
and
there's
we would
more.
be here.
There's other
I
groups, there's
know.
other support.
Yes. And come back next week. Dr. Rob has more time to answer questions. And if you want an expert consultation with him or want information, email Tammy, TAMI at seekingintegrity.com. I'll do my best to help you out. Thanks, Dr. Rob. Thanks
Thanks,
everyone for the
guys. Have a
great
good evening,
questions. Thanks for
afternoon.
being with us.
Good to see you, Tammy.